So we're going to start with the posterior, or the back of the body. The first muscle that we have here is the largest muscle of the upper back and neck. It's called the trapezius, It is a muscle, again, paired on both sides. It is taken away here so you can see the muscles that are deeper. But the trapezius, that is the trapezius. The trapezius. If you peel that away, you would see our trapezius is going to be the most superficial and the largest muscle of the upper back and neck. If you take it away, you'll find deep to it the rhomboids. The rhomboids run between your two scapula or your two shoulder blades. They're there, and then right above that, deep or underneath of the trapezius, is what we call the levator scapula. That runs from your shoulder blade or scapula all the way up to your vertebrae. So that's very important. Gross muscles or large muscles: trapezius, rhomboid, levator, scapula. The trapezius, again, is most superficial. You take that away and you'll get to those other two muscles. There are additional muscles that are deep to those that are closer to your vertebrae as well, and your ribs. On your scapula, you have what we call the rotator cuff muscles. What you can see here would be your infraspinatus, your teres major, and your teres minor and your supraspinatus. These are, again, muscles that are going to run from your scapula onto your arm and create rotation movements. This is why they're called the rotator cuff muscles. Okay. Again, very important muscles. As we move down our arm, posteriorly, we have our tricep. This is our tricep muscle. It is actually one of the only muscles. It is the only muscle in your posterior, or in the back of your arm. It is called a tricep because it has three heads, which makes it such a bulky muscle. So it's almost like three muscles, but it's one muscle. As we move into our posterior forearm and hand, we're going to have muscles that we call the extensors. These muscles are going to be muscles that are going to bring our hand towards the back of the arm. So we're in anatomical position. Those muscles would bring our hand backwards. Those are the extensors. So they're here and they're working to pull the arm back. If we go on to the other side, you will see again the same mirrored feature on the opposite arm. Let's move into our mid-back. Large muscle here is called the Latissimus Dorsi. This is known as the swimmer's muscle. It's a big muscle you might see jump out when you see your swimmers in their races. It's that muscle that's going to help to bring their arms in and down so that they can penetrate the water and continue in their race. So that's Latissimus Dorsi. It means wide back. It is the widest muscle in the back, largest muscle on the lower back, competes with the trapezius. So that's Latissimus Dorsi. And then deep to that, you'll have a muscle called the Quadratus Lumborum, the QL. That is the muscle that is going to run. Actually, we cannot see it well here, but the QL is going to run from your ilium, which is your hip bone, and run up to your 12th rib. And that muscle here is going to allow you to hike your hip. So it runs from here on your ilium and runs up to your vertebrae. The QL, another major muscle. Let's see. As we move down posteriorly, we will see our gluteals. This group of muscle is called the gluteals. Of course, the largest one is the gluteus maximus, but you also have a medius and minimus. Minimus you can't see well. It is deep or underneath of the gluteus maximus. But again, this group of muscles are going to be very important for us being able to stand, to walk, climb stairs. Very important muscle that needs good work. Continuing down your inferior limb, we have our hamstrings. So this is a group of three muscles in the posterior leg, hamstrings. They are going to be what we call biarticular. They cross the hip and the knee. So they're going to have actions in both areas. So they're going to do something at the hip. They're also going to do something at the knee. So that's your hamstrings. When you get to your calf muscles, you'll see there are several muscles here. Your gastrocnemius is the one that is closest to the surface or to the back of the body. It's most superficial there. Gastrocnemius or gastrocnemius. And deep to it is a nice thick muscle that you'll see on the side, come out the side. I call it the Arnold Schwarzenegger muscle because if you ever look at his lower leg or his legs, you will see that muscle coming out on the side. That's called the soleus. The soleus comes out on the side of the gastrocnemius. This Achilles tendon is a common insertion, is a common piece of both of those two muscles. Again, it's part of what makes those muscles sturdy, but also it can be subject to injury. So we have to use caution when we're working those areas. In this picture, you'll see they've cut the belly of the gastroc and you can see the soleus deep to it, but again, it comes out on the side as well. So gastrocnemius and soleus, major calf muscles. Your foot muscles, we will get into in lots of detail, but just make note that there are lots of muscles in there that help you do all of those fine movements that your toes need to do to support your weight and also to help you navigate. And I think that we've done the major muscles of the posterior body. I am going to jump back up to the skull to make sure that you see here that we have the occipitalis is in the back of the skull. It is going to contract to raise your eyebrows because this muscle attaches to this fascia and tendon here called the gallia appenodica, and that is going to connect to your frontal bone and pull the tissues here upward when you to raise your eyebrows. Deep to this, we do have a group of muscles called the sub-occipital. Sub means under, occipital, under the bone. So under the occipital bone. So you're going to be under the occipital bone, and there are deep, little small muscles that are also very important to work. They are known to be the cause of muscle tension that may lead to headaches in that area. Again, you cannot see those, but those are muscles you want to make a note of, sub-occipitals. So that is our our posterior of the body. So that is our posterior. We're going to move to our anterior of the body. We're going to move our light a little bit so we don't have as much reflection. There you go. And so we're going to start with our face. Very important muscles up there in the face. These are all what we call muscles of facial expression. Those muscles are important for us to communicate. They allow us to kind of give information about how we're feeling, what we're doing, what we're thinking. There are many of them, so we're not going to definitely go through all of them now, but some that you want to make note of is this is the frontalis. It is the antagonist and synergist. Means it helps it and works against the occipitalis that we talked about. So this one's going to contract to burrow your furrow. It's going to contract to frown your face, your forehead, wrinkle your forehead. Could not get that word out. So this is going to contract to wrinkle your forehead, the opposite of raising the eyebrows. Those are connected to the same tissue and they kind of just move over the top of your head. One pulls everything back, the other one pulls everything forward. Remember that muscles are like a pulley system. They're just grabbing onto bones and making movements occur. Also in the face, you have circular muscles around the mouth and the eyes. The first one is called the Orbicularis Oculi. That's going to squint your eyes. You have your Orbicularis oris, which is going to help you to purse your lips. And then you also have your smiling muscles, which are on your zygomatic bones, called the zygomaticus. And that's going to help to just bring everything up so you can smile. Additionally, in the anterior, we have a very popular muscle here called the Scm Sternocleidomastoid, the Sternocleidomastoid muscle. That muscle is very important to help us with our movements of our neck, especially turning from side to side. And what else can we see here? We have some deep muscles, posterior and lateral to that, called the scalenes. You can't see those well, but the scalenes are here in the lateral posterior neck. They're going to come all the way down and grab onto your ribs. Those are going to be very important with your respiration as well as your neck movements. As we move down our anterior thorax, we have our Pectoralis Major. The pectoralis major is the main chest muscle, but if you were to take it away, you have one deeper called the pectoralis minor. So pectoralis major, minor are going to be working to move this area, whether it's pulling your scapula or your arms, it will be helping to move this area here. On your shoulder, top of your shoulder, lateral, anterior, and posterior, we have a muscle called the deltoid. The deltoid is another muscle like the trapezius that has a lot of actions, but and is big and covers a large area. Deltoid. On the anterior arm, we have our bicep brachii. Bicep brachii is a very common, popular muscle. It is a muscle that's going to help to flex your arm, but it also is responsible for a movement called supination, which you're going to take your arm and move it, your forearm, and have it, your palm face upward. So that's your bicep brachii. This muscle here is called the brachioradialis. It runs from your lower humerus all the way down to your thumb. It is the muscle that you will be using to create the handshake movement, and it stands out in addition to, or kind of merges in, but stands out from the other muscles that are in this area. These muscles are called flexors. They are going to bring your hand into this position. So if you're in anatomical position, the flexors of the wrist are in the anterior forearm. They're going to bring the hand this way. We talked before about the extensors of the wrist here that brought the hand that way. So that is your major arm, anterior arm muscles. Let's move back into our thorax area. We do have a muscle here called serratus anterior. You cannot see all of it, but it's a muscle that anchors onto your ribs and comes all the way around the back of your body and grabs onto your scapula. That muscle is also known as the boxer's muscle. That muscle is going to help your scapula stay attached to your axial skeleton when you're making movements like reaching, boxing, or any activities that you may do that requires arm movement, and make sure that your arms stay nice and in place and don't separate from your axial skeleton, the serratus anterior. As you move down, you're getting to your abdominal muscles. Your abdominal muscles are going to be your obliques on the outside of the body, and in the anterior center, we have what's called the rectus abdominis. This is known as the six-pack muscle. That muscle has little tendinous attachments and the belly separates, so it creates these little packs. And so that's why it's called the six-pack muscle. Very important muscle for our strength, our core strength, and our ability to be stable in our core region. Along with the obliques on the sides or the lateral portion of the abdominal area, the obliques are going to help with movements to the side, so that the twisting motion that we make will be your obliques. What else? As we move down, we can't really see them here. Before I move down deep to this, we have muscles all along our rib cage, rib muscles that also help with our breathing. And we have the diaphragm, which is the internal muscle that's going to allow our lungs, give space for our lungs to expand and to collapse. And that is the diaphragm right there. It separates your chest cavity and your abdominal cavity. So that is the diaphragm. Those are deep. You can't see them from here, but they are very important muscles of respiration. So as we move down to our lower extremity, we have the TFL, or the tensor fascia lata, a nice muscle here on the lateral side of your hip. And then we have the psoas muscle, which we can't really see, but it's also a very important muscle. The psoas muscle is going to come all the way from your lower back, and come through the abdominal cavity and attach to your legs. It is a very strong muscle. You kind of can see some of its, you'll see some of the other muscles that are in the area, but the psoas major. Then we have our adductors. On the inside medial portion of your femur, you have the adductors. These are muscles that bring your legs together. Okay, so adductor, the movement adduction, add to your body, bring it back. Anterior femur are your quadriceps, 4 muscles at various depths, but 4 muscles that are going to help to move the knee as well, just like the hamstrings in the back, that those muscles are going to all attach to your lower leg or to your leg and create the movements of the knee. Long muscle, longest muscle in the body, going from your hip across your femur and then connecting down by the knee. And this is called the sartorius. The sartorius is the muscle that is going to be responsible for allowing us to sit in crisscross applesauce. So it allows us to cross both of our legs. So that is the sartorius. As we move into our leg, we can still see the gastrocnemius, which is that calf muscle, and the soleus. You can see both of those muscles from the front. That's why if you ever look at your leg and touch it, you'll see the front of your leg is very, very non-eventful. There's muscle there, but very thin muscles. The main muscles that you have there are your tibialis muscles. They're on that bone called the tibia. They're going to help to bring your foot up like that. And then on the sides, we have what we call the peroneals. The peroneals are muscles that are there to help our foot move out. If you're a driver, you use those peroneals to take your foot from your gas to your from your gas pedal to your brake pedal and back. So that is your anterior muscles, gross muscles of the body.